Hello, everyone. It's Wednesday, November the 2nd. Thank you so much for being with us and everything. I'm going to again ask for your prayers. You know, since the last time we were here and everything, we've had 20 additional folks die in West Virginia. And this puts our total at 7,534 people that we've lost. The 7,515th death was a 60-year-old male from Kanawha County. The 7,516th death, a 75-year-old male from Fayette County. The 7,517th death, a 79-year-old male from Kanawha County. The 7,518th death, a 76-year-old male from Fayette County. The 7,519th death, an 89-year-old female from Mineral County. The 7,520th death, an 88-year-old female from Braxton County. The 7,521st death, an 82-year-old female from Kanawha County. The 7,522nd death, an 84-year-old male from Raleigh County. The 7,523rd death, a 57-year-old male from Kanawha County. The 7,524th death, an 87-year-old male from Kanawha County. The 7,525th death, an 82-year-old female from Wyoming County. The 7,526th death, a 63-year-old female from Lewis County. The 7,527th death, a 69-year-old female from Raleigh County. The 7,528th death, an 87-year-old male from Marion County. The 7,529th death, an 83-year-old female from Jefferson County. The 7,530th death, a 44-year-old female from Nicholas County. The 7,531st death is 58-year-old female from Raleigh County. The 7,532nd death is 71-year-old male from Kanawha County. The 7,532nd death, a 71-year-old male from Wyoming County. The 7,533rd death, a 79-year-old female from Kanawha County. And the 7,534th death in West Virginia is a 70-year-old female from Kanawha County. I want to make absolutely certain that the 7,531st death was a 58-year-old female from Raleigh County. I ask for your prayers all the time. Please, please, please. If you know these folks, call them, go see them, reach out to them. The worst thing on the planet can be for all these wonderful families and their loved ones is to feel alone. Don't let them feel that feeling. Please send up your prayers and please call. Please go see them. Active cases in West Virginia, 970. New positive cases at 311. Daily positivity rate at 5.01. Cumulative rate at 8.55. There's over 600,000 people in West Virginia that have recovered from COVID. 162 that are hospitalized. 23 in the ICU units and 9 on ventilators. And you can see most of our state is green and yellow. Well, it's all green and yellow, but that's surely not too awful bad. But we've still got to realize this thing's not going to go away. It's going to be with us. We can live with it, but it's there with us. The Omicron booster shot, you know, is out there. It's available to 12 and older, and without any question, I absolutely urge you in every way to get this shot. But especially if you're 50 and older, you hear me every day, read all the names. I think there was one lady, if I'm correct, that was 44 years of age. Everybody else 50 and older. Please, please get your booster shots. The numbers continually do get a little bit better. We're at 92.4% of the 65 and olders that have had at least one shot. And they keep on just getting a little teeny bit better. But everyone we can get across the finish line is maybe a life we're going to save. So it's absolutely important that we be here, and important, in my opinion, that we continue to remind you and everything, because every day we get a little bit better. The vaccine calculator that's going to give you insight as to when to get your booster shots and everything is on our website. You can get on it and figure out how to get registered into that, and all the information on our COVID vaccine info line is up, and you know, for your benefit. Long-term care facilities, we're down to 40 outbreaks, none in our church community. We have 30 inmate cases and 13 staff cases. All the stuff on our homeowners assistance program is up and it's still available to you. All you got to do is call us and see if we can get you qualified. I remind you over and over about giving blood, really, really important, but please check with your physician. And if you can do so, consider it, please. In regard to Amendment 2, I'm all over the state, and I'm all over the state for one reason and one reason alone. I'm not, all over our state to pick a food fight. I mean, for crying out loud, that's the last thing on earth I need. But really, when it really boils right down to it, the people need to know. The people need to know and need to know ever so clearly. I guess the biggest disappointment that I have is we knowingly have tricked our people. That's what we've done. And not me, but surely others. We bragged about it. We went around everywhere saying, I know what we can do. We can tell people that Amendment 2 is nothing but about your car tax, and they'll have to vote for it. And really and true, Amendment 2 is surely about so much more than that. I have a methodology to get rid of your car tax forever and ever and ever. And to be perfectly honest, the other side doesn't even have that. Your car tax is off the table. Amendment 2 is voting now for one thing and one thing alone, changing the Constitution, taking all your control away from you, your counties, absolutely putting at jeopardy your policemen, the schools, on and on and on, the senior programs, the youth sports, on and on and on. At the end of the day, if we pass Amendment 2, we will absolutely hurt ourselves forevermore. And at some point in time, and you mark it down as well as I know my name, at some point in time, we'll go upside down. Now, I may be long gone as your governor by then. But really and truly, when we go upside down, it will be an ugly day for our counties. And we won't know where to turn. And with all of that, the only place that we'll have to turn, and it's mark this down as well, absolutely what we will do is we will turn at our county levels and we will raise the assessed value, and literally your property taxes will go up. Now, you remember Jim Justice telling you this because he's probably going to be long gone. But with all that being said, why in the world are we giving up local control? Why are we doing that? Local control with a guaranteed income stream. In my scenario, we have the best of two worlds. Literally, we take surplus dollars and we rebate you back for your taxes, and we do not have to change the Constitution at all. It's just as simple as that. And it can happen that quick. Now, with all of that, then what happens? Then your regular car tax dollars, they still go to the counties. But you don't have to pay because you're getting rebated back dollar for dollar. We win on both accounts. We don't have to change the Constitution. The counties still get their money, and you absolutely do not have to pay your car tax. Or the net of the whole thing is you weren't out 1 cent on your car taxes. So with all that being said, I do think that everywhere I go, it's hard to dispute really what's happened here. Basically, we have hidden stuff and we have couched it as this way you'll get rid of your car tax. Even one of their ads on TV says, this is going to mean $700 to every working family in the state, or something to that extent. Where does that come from? Where in the world does that come from? I mean, at the end of the day, and in my scenario, I can get rid of your car tax positively. But beyond your car tax, the working, everyday person in West Virginia is going to get zero. Zero. And you're going to put at risk your counties, your schools, your policemen, and everything under the sun. You're going to get zero beyond the car tax, and the car tax I can do. So with all that being said, it's an ad that is deceiving. It's not right in any way. And on top of all that, it doesn't really mention really all the things that are repercussions that can come. And the worst of it all is you're just giving up your rights. You're giving up your independence. That's all there is to it. People that are working really hard today are really fighting this inflation issue in every way, whether it be gas prices or grocery prices or whatever. And when it just really settles all out, you know, there's no need for us in the state of West Virginia to not reward our people back and give them tax breaks of their personal income tax. We can get on a pathway of getting rid of our personal income tax and put money right back in the very pockets of our people. Now look, I've said it 10,000 times. I'm right about this. Who's going to benefit from the passage of Amendment 2? I guarantee you who's going to benefit. Big, giant corporations, primarily, and corporations that are, in many cases, are out of state. I just got through meeting with a group of people on a really exciting deal that could very well come to Weirton. In all of that, think about Berkshire Hathaway and Pure Watercraft, Nucor, and on and on and on. These people that were here today, not one mention of, well, we'll come to West Virginia if you'll get rid of that machinery and inventory tax. None. They are coming like crazy. Why in the world do we need to go down this path and put at risk our counties? Why do we need to be doing this? I mean, this is absolutely silly in my book. So at the end of the day, let me tell you just this, and I'll be quiet when I'm through with this comment, and it's just as simple as just this. You got working families out there that are really dealing with inflation and are hurting. We can cut their personal income tax after we get rid of the car tax. We can cut their personal income tax, and then all those folks live here. They live in West Virginia. They're going to spend that money in West Virginia. It becomes our own incentive program in West Virginia. Literally, at the end of the day, do we want to turn our backs on them and turn our backs on our counties and put all this control in Charleston and have the counties lose all that control? Do we want to really turn our backs on our own families and send all this money to giant corporations out of state? And then, if we have a bump in the road, and we will, and I want you to remember me sitting here telling you that, we will have a bump in the road. Now, I'll probably be long gone as your governor. But when we have that bump in the road and the counties are upside down, the next thing that'll happen is your taxes, property taxes on your homes and whatever will be raised. So the net of the whole thing, you can get rid of your car tax easy. You don't have to change the Constitution. Don't have to lose control at the county level and everything else. And you surely don't need your property taxes going up. That's what's going to happen. You know, I'm going to be in Wheeling tomorrow at 11 o'clock. You know, welcome anybody to come out and talk. And all we're doing is just discussing all the pros, the cons, and at the end of the day, if somebody wants to, you know, ask a question, I try to answer as best I can. Every time I've had, you know, Secretary Hardy with me, and he's got a tremendous amount of knowledge, and we left him on the sideline, not me, but the other side didn't want to hear from him, and so nevertheless, he'll be with me, and there won't be any political tricks or anything like that. There'll just be straight talk from us, and at the end of the day, we'll let the voters decide. And when the voters decide, we'll be respectful. I would tell you just this, and this is honest to goodness truth, and you can investigate it any way you want to investigate it, but at the end of the day, if Amendment 2 passes, it will literally put millions of dollars into Jim Justice's pocket. And Jim Justice is sitting here with his companies, that's what it'll do. it will save millions of dollars to for Jim Justice. And Jim Justice is sitting here telling you don't do it. I didn't sign up to get my property taxes cut. I didn't sign up for a special perk for me. I didn't sign up for anything that I want, nothing. I signed up for you, and that's where I'm going to stand. Okay, here's something, like I said the other day, it was really, really interesting, and this was a report that came out from the Tax Foundation. The Tax Foundation is the very, very group that everybody uses. Well, West Virginia is ranked 20th in the nation as the best business climate of anybody. They're ranked 20th in the nation. The states around us, all the states around us, Kentucky's 18th, but you can see Ohio's 37th and Pennsylvania's 33rd. I mean, for crying out loud, who wants to be Ohio and Pennsylvania? We're the ones that are really doing it. And on top of that, here's the thing that you've got to pick up on. Who's number one? Wyoming. Who's number two? South Dakota. Who's number three? Alaska. Who's number four? Florida. Who's number seven? Nevada. What do all those states have? They have no personal income tax. You know, the best. They're the best business climate. So much at stake here. You got to be really careful. We're going to be at the Culloden interchange here in just a few minutes and everything at 2 o'clock today. I'm holding a groundbreaking ceremony for the Culloden Interchange project. It's another project made possible by Roads to Prosperity. You know, it had been shelved for years and years and years, and now we're in full mode, and we're getting ready to have a wonderful interchange right there. And so lots and lots and lots of good stuff. It'll bring more and more growth to Putnam and Cabell County. You know, it's really good, really, really good. You know, Alzheimer's is something that is racing across this land, and it's been terrible in many, many ways for lots and lots and lots of folks. We'll be lighting up the Capitol in recognition and everything, and I have issued a proclamation declaring tomorrow as Alzheimer's Awareness Day in West Virginia. We'll also tomorrow, our Capitol Dome will be lit in the color teal, joining the Alzheimer's Foundation of America's annual Light the World in Teal initiative to support Alzheimer's awareness. So please keep in prayer all those that are suffering this dreaded disease. Today I'm happy to announce the 2023 Almost Heaven Governor's Arts Exhibition. This year's exhibition calls for one-of-a-kind postcard designs that illustrate your favorite West Virginia park, whether it be city, county, or state. And so all kinds of really great stuff that's happening and everything. This is all for our K through 12 kids and everything. The winners receive arts materials and all kinds of neat stuff, and the amounts of $150 and $25 awards, and really, really good stuff. As far as our revenue numbers, October we knocked it out of the park again. It's really, really, really good stuff. You know, we were $147.8 million above estimate in October. That's all great, and we continue to just keep churning it out in West Virginia, and the last thing on earth I'm going to do is sit around and be ashamed of the fact that how good we're doing in West Virginia. We want to keep on doing good, and we're going to try with all in us to keep on doing good. Only thing I would just tell you is just this. I have been the business guy that has been mindful of the right way to run the store. And absolutely nobody that's got a good head on their shoulders about business would not step up and tell you that along the way, there's going to be bumps in the road. Right now, we're really cooking. We want to keep on cooking and everything. If we don't blow our legs off, we're going to try as hard as we can to do just that. And I think that's the last thing I've got, Let me make sure. Yep, that's the last thing I've got. Thank y'all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar. Well, good morning, and supporting what the governor has repeatedly told our state and continues to do so, that we still see people who are dying of COVID-19. In the country, our number of deaths per day has remained pretty stable at about 320 deaths a day. Put that into perspective, a 747 airline with a normal set of customers will be around 400 to 450 people. So it's like a airliner going down every day. We also know that the variants from COVID-19 are changing. And that is something that we're keeping a close eye on for West Virginia as well as for the rest of the country. The variant that is changing now in the United States, and not quite yet in West Virginia, but we anticipate that we will see that happen in the next several weeks, is that the BA.5 variant, the Omicron variant, that's been the most common variant now for a pretty long period of time, is giving way to another set of mutations in the BA.5 variant, which is giving this new form of COVID-19 a higher ability to infect people and to avoid immune systems, particularly immune systems that are not informed by being up to date with vaccination. And these new forms of COVID-19 have changed from BA.5, and now they're called BQ1 and BQ1.1. And the combination of BQ1 and BQ1.1, and the last time that was assessed, account now in the US for about 27% of the total number of cases of COVID-19. And there's other variants in parts of the world, but the BQ1 and the BQ1.1 are the two variants that we are looking at very closely. In New York, we have seen a surge of BQ1 and BQ1.1, and hospitalizations have gone up from around average of 2,000 in July or so, now to around 3,000 a day. So it's not a dramatic surge like we've seen with the Delta variant, but it's still concerning. And we know that many people that are getting sick now with the BQ1 and the BQ1.1 variant are either unvaccinated or have not been vaccinated for over 6 weeks. And so we know that when we look at the new Omicron boosters that have been created, we have new data suggesting that these boosters work really well against the BQ1 and the BQ1.1 variants. So really good news in that way. But we also know that the number of Americans who have chosen to be vaccinated is still very low. And I know that either Dr. Amjad or General Hoyer will go through some of the more up-to-date numbers for our state. But nationally, it's about 7 to 8% of all eligible Americans have gotten the new Omicron booster shot, and only about 20% of Americans over 65, who are the ones that are at the highest risk for a lot of complications. So again, the BQ1, the BQ1.1 are the new variants that we're watching closely, and they are growing quickly like we've seen with other variants that have been dominant. So those are definitely the ones to keep your eye on. The other thing that I want to point out is there's a recent study that came out of the census data and was published in the Journal of American Medical Association. And what it suggested is that about 15% of Americans report who have had COVID before that they had developed symptoms that would be consistent with long COVID that would average about 2 months or so. And a smaller group of people had symptoms for longer. The average age of the people reporting these prolonged symptoms was about 40 years old, and a good number of women reported them more than men, which is interesting And while that could be just a reporting sort of error, it also might give us insight. And also older people who got COVID were more likely to develop the symptoms of long COVID. And the really important finding in this study, in my opinion, was that what they found was the people that reported symptoms of long COVID, women or men, 87% of these people did not have any vaccination. So it looks like having vaccination to the COVID-19 virus, full two-shot vaccination to begin with, and staying up to date with your booster shot is really important, not only to protect you from hospitalization and death acutely from COVID, but also potentially to protect you from the consequences of long COVID. So thank you very much.
All right, thank you, Doctor. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just to reinforce what the governor and Dr. Marsh have laid out, you heard the governor list off a number of older West Virginians that we, again, have lost. Dr. Marsh talked about those national numbers of Americans that we've lost, and we know that more people have been hospitalized from Omicron infections than any other variant. And those are the reasons why the governor continues to press this team to do outreach, to do education, to be on these events, to support events out there in the communities, to include, we continue to support a number of efforts with businesses, retailers, other organizations, to do events to get those folks those booster shots, in particular that Omicron booster shot. Our number for 18 plus is actually at 11.69%, so ahead of the national numbers, but not nearly as the governor and Dr. Marsh, Dr. Amjad, Secretary Crouch have all pointed out, not nearly the number we need to best protect the citizens of our state. We are running at about or above the national average for over 65. So again, please use, if you have questions, use the vaccine due date calculator at Vaccinate.wv.gov. If you want to talk to someone directly, you can use the vaccine info line at 1-833-734-0965. And it's also, we receive regularly questions from folks, can I get my Omicron booster and my flu shot at the same time? Yes, you can. And it is actually now considered a best practice to do both at the same time. So again, please pay attention. We've got to get more West Virginians the flu and the COVID vaccine. With that, with those two and the RSV that's impacting particularly our younger population in the state, we want to keep those numbers down so we can manage this throughout the winter season. And again, please pay attention if you have older relatives around younger children who may have RSV. Older adults are also very susceptible to and can be significantly impacted by RSV. Thank you.
Thank you, sir. Dr. Ayn Amjad and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Governor, speaking of bumps in the road, a long-term outlook for PEIA foresees $376 million in state expenses 5 years out by 2027. By then, the outlook suggests PEIA will have exhausted its rainy day fund that you established to guarantee that no premium increases would occur for state employees over the next few years. You're fond of saying dupe happens. Should West Virginia be cautious about any tax cut that could reduce the money available to deal with issues like this? Thanks.
Brad, it's a great question. It's a perfect example of what I've said over and over and over. It's just, from the standpoint of your question, to answer your question exactly, Brad, we should aggressively look at tax cuts. but we should be really wise and smart and know what we're dealing with. You know, if we'll just be fair, we can get rid of the car tax and we can get that gone right now and help our folks. And absolutely, I've got a methodology and a way to do that, and a way to do that for absolute certain without changing our Constitution. You know, that's just, we can do that tomorrow. And we cannot put ourselves in any level of risk, and we can do that tomorrow. Now, Brad, when you think about it, if you just then layer in what is really going to happen if Amendment 2 passes, the whole thing has been about one thing and one thing alone, and that's the machinery and inventory tax. So when you start trying to take on that level, now you're layering in another $500 million. Now you're really layering in some level of risk, but it's not just that. If the utilities, the railroads qualify, and the language is very ambiguous to whether or not they qualify for the machinery and inventory reduction as well, and if that be the case, now you're going to layer in another $150 or more million dollars. So now you may be up approaching $700 million, plus the car tax was $140. Now you're above $800 million, and you're really, really exposing yourself. Now you're really, really in a situation to where absolutely dupe can happen. If you pass this Amendment 2, which is nuts in my book, the counties are going to give up all their control to Charleston, and if that happens, and you're seeing right now the report that came out, in fact, they just handed me this report as well, to where just a few years out, we're forecasting, or our people, or I guess the PEI folks are forecasting, that we're going to be upside down $376 million that we're going to have to fund. And then it's going to probably continue to go up. Now, Brad, let's again be just straight honest. Here's what we can do. We can start changing the rules of the game. You know, we can take away benefits. We can say, well, your spouses don't qualify. You know, or if your docs are out of state, you know, across the border, and you're a border county, you can't go over there. If you go over there, you know, you gotta pay less or whatever it may be. We can start changing the rules of the game to all the folks that are on PEIA, you know, or we can start raising premiums, or we better absolutely just step back and know that dupe does happen, doesn't it, Brad? And it does. And literally along the way, whether it be matching funds for our highways or pay raises or PEIA or whatever it may be, there's things like this that are going to happen all the time. And we've got to be able to manage our way through this and do the right thing from the standpoint of what is right for all of us. Because at the end of the day, and that's why I am so adamant about you know, voting no on Amendment 2, because at the end of the day, if we vote yes on Amendment 2, then we're going to just suck right out of the revenue, whether it be $600 million or $800 million, and that's gone. I just met, Brad, just a few minutes ago with a company that is really, really dialed into coming to Weirton. And literally, it is just like an instant replay. Over and over and over and over, people are coming to West Virginia, and nobody asks about the machinery and inventory tax. Nobody. Why are we doing it? Why in the world are we doing it? And Brad, I am not opposed. I'm the business guy. For crying out loud, I'm the business guy. I love big business. And I love the opportunity of what it brings, but we just got this backwards. What we should do, get rid of our car tax tomorrow. Absolutely, and I've got a methodology to do that, and it's gone. You know, and then what we should do is we should get on a pathway of reducing our personal income tax and rewarding our people. Our people are hurting, for crying out loud, and we can get on a pathway of doing that without exposing us. without exposing us to it. And then I say over and over, and then breathe. Just take it easy and breathe just a little bit. And then if things are really good, start whittling on the machinery and inventory tax. Don't just absolutely blow your blooming legs off, West Virginia, and literally at the end of the day, I'll probably be long gone as your governor. I am absolutely certain that if we change this Constitution and literally we put control back on everything into Charleston's hands, and politicians come and go, don't they? Some get elected, some don't. At the end of the day, the worst thing we've done here, in my opinion, the very worst thing, is we have knowingly misrepresented what Amendment 2 is about. We have told people Amendment 2 is about getting rid of your car tax. That wasn't what Amendment 2 was ever about. Amendment 2 was about changing the Constitution, taking control away from the locals and putting the control in Charleston. It was a power grab. Absolutely, we tricked the people, and we didn't include me. That's all there is to it. And we strutted around and bragged about it. Look what we're going to do. We're going to put the car tax with this, and then they'll have to vote for it. The worst of the worst, in my opinion. Nevertheless, I'm sorry to be so animated, but Brad, you're right. 376 million shortfall in PEIA. The only thing we'll be able to do is just go back and start changing the benefit package or upping the premiums or whatever it may be. There will be dupe happen. I guarantee it. It happens in our house. It happens all over the place all the time. You just got to really be in charge of managing your finances at your house or your businesses or whatever it may be. There's so many things we could do, Brad. We could get rid of the car tax. That's first and foremost. We could get on a way of reducing the personal income tax. We could structure benefits that would be just designed for our small businesses. We could do things, just tax breaks for our smallest businesses in West Virginia. We could do all this without absolutely invading the Constitution. Priority, without any question, in my opinion, should be on our people. You know, last thing is I tell you this, and Brad, it's fact. Watch the commercial on TV that is pushing the passage of Amendment 2. It says your family is going to end up with a $700 tax break. You know, well, now just think about it. Just think about it. I can positively promise you getting rid of your car tax. I can do that tomorrow. Absolutely promise it. Beyond that, what's the working family going to get? What are they going to get? They're not going to get another blooming dime. Why are we doing this? They're not going to get one more penny. And you know what we're going to do? We're going to send our money out of state. We're going to send the big giant blocks of this money out of state forevermore to big giant companies, whether they be Walmart or whomever it may be, Dow Chemical. And I'm not opposed to the giant companies, but they're doing pretty dadgum good. And you've got our people that are fighting on how they're going to pay the grocery bill. Let's just get it the right order. First the car tax, then the personal income tax. And then let's go back and try to craft something for small businesses maybe. And then let's bite at the machinery and inventory. That's all there is to it in my book.
All right, thanks, Brad. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to follow up on what General Hoyer said about RSV. Could you talk a little bit more about what we're seeing in the state, how that's impacting the hospital? And I know we've previously talked about, the new variants on top of flu season exacerbating the staffing issues. Is this a third concern on top of those others? Thank you.
General, please.
Yes, Governor. Yes, Charles, we are hearing of surges in hospitals around the state, particularly with pediatric children cases of RSV, and it is something that we have been looking at with the Hospital Association and their members related to managing those issues as well as COVID and flu issues. And Dr. Marsh may be able to speak a little bit more to what we've seen here at the new Children's Hospital in Morgantown related to RSV cases.
Governor, are you okay with me to add a couple things?
Please.
So thank you, Charles. We are seeing an early season with RSV, which is respiratory syncytial virus. And we know that this is particularly problematic for very young children because the airways of these children are much smaller than adult airways. And because of that, the inflammation that we can see inside the airways can make it very difficult for infants to breathe who get sick with RSV. And I think that with RSV now really showing itself early, and we're also starting to see some of the flu cases, influenza A, it's going to become really important for parents of young children particularly, but also older West Virginians who are also at risk from complications of RSV and influenza, to be careful about, gatherings where there's sick people and particularly as it gets colder, to pay attention to who your very young children are around and who you're around if you're older or compromised, because this is a time in which COVID may become a bit of an issue over the winter. Plus, with RSV and influenza, these three infections are causing us concern. And we've talked about the shortage in staffing, but people who are staff, who are, working in hospitals are also at risk for this. So we really do want people to be careful to get vaccinated, get your flu vaccine, stay up to date with your Omicron booster vaccine, but also, do the other things that we know works to reduce infections, respiratory infections, like, wear a mask if you're in a high risk situation, stay your distance, be careful who you're interacting with and in what venues you're interacting, at least for right now, as the weather's getting colder. Thank you.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
There we go. You'd think I'd learned this by now. Governor, I'm intrigued by this talk of economic development announcement in Weirton. Can you tell us a little more without giving away the store? Are we on the verge of something akin to Nucor or Berkshire Hathaway? Can you tell us what sector it might be in? And given that it's in Weirton, is the Ohio River access a crucial part of this project?
Well, the river is absolutely crucial, and I really, I'm kind of looking for somebody on my staff to tell me if I can tell you more. I'm probably been told now, that I've probably told you maybe enough, if not too much, but I can tell you the river is crucial, and I can also tell you that from the standpoint of we're very fortunate, to have rail and air and water is all across our state in many different places, and that's really crucial and it's really good. But I think it would be fair to say that we're looking at, this company is looking at a lot of the properties and everything, whereas some of the existing steel works, went on, and so this could, if this becomes a reality and everything, it is substantial, and it could end up right in downtown Weirton, to tell you the truth.
All right, thanks, Mark. Next to Stephen Adams with Ogden Newspapers.
Hello, Steve Adams of Ogden Newspapers here. Question in regards to this new subvariant of Omicron. This is probably for Dr. Marsh, but obviously as these subvariants have come across, they have all become more infectious and they all find ways to get around some of the immunity. But as far as deadliness, are we seeing this act any deadlier? Is it as far as its potency in that regards? Is it getting weaker, staying the same? What exactly are we looking at in regards to that? Thank you.
Hey, Stephen, Dr. Marsh had to drop, but Dr. Amjad's on. Maybe Dr. Amjad, can you add to this, please?
Yes, Governor. Steve, that's a good question. And what we're seeing right now is that the subvariant isn't more deadly per se, but it is still causing some more infections or cases. You know, New York right now, New York State is seeing a slight uptick in some hospitalizations. West Virginia tends to lag behind other states, but so far it isn't deadlier the way the Delta variant was that we were seeing. And part of it is because people are vaccinated and still following good practices. So I guess it remains to be seen, but right now I wouldn't say it's deadlier, but it's still infectious. Thanks.
All right. Thanks, Stephen. Governor, back to you.
Well, again, in making the notes, all I got really to add is, Dr. Marsh, surely made reference to the fact that if you've got your booster shots and your vaccines and everything, this dealing with the side effects of COVID, the long COVID situation is surely significantly less. And in fact, I think he used a number like maybe 87% or something like that. But it's something that should be taken into consideration, and from the standpoint of all the things that are going on and everything, we've got an election coming up. We want everybody to vote. I mean, it's an important time, and we want everybody to vote. And from my standpoint, I urge everybody, every day to, that I'm on and everything, think real hard about Amendment 2, because, I personally believe that we're giving up our rights, giving up a lot of local control, and at the end of the day, if we don't watch out, we could go underwater. We go underwater, we've got big time problems. So just take time to talk to someone and let them explain and everything. A lot of times, we work real hard to put things on the ballot, and they lead people to believe, it's so simple to make a real mistake. And so with all that being said, go vote, exercise your rights. We're going to absolutely be respectful of the outcomes of all the elections and everything, and we're going to move forward as great West Virginians and great Americans. So thank you so much for having me. Thank you.